Pitfalls in non-invasive positive pressure ventilation, NIPPV, for neuromuscular disease. 1. Over-reliance on supplemental oxygen. Pitfall: increasing FiO2 to address desaturations without addressing the underlying causes, e.g., mucus plugging or atelectasis. Consequence: masking critical issues like retained secretions or ventilation-perfusion mismatch, potentially delaying necessary interventions. Solution: focus on chest X-ray evaluation, airway clearance devices, e.g., cough assist, and adjustments to pressure settings. 2. Inadequate pressure settings. Pitfall: failing to optimize IPAP and EPAP settings to ensure adequate chest wall expansion and ventilation. Consequence: ineffective ventilation, increased work of breathing, and suboptimal gas exchange. Solution: adjust IPAP to 12 to 24 cm H2O and EPAP to 3/8 cm H2O based on the patient's needs and response. 3. Mismanagement of triggering and backup ventilation. Pitfall: not providing an adequate backup rate for patients unable to trigger the ventilator. Consequence: periods of hypoventilation and respiratory fatigue. Solution: ensure a reliable backup or minimum ventilatory rate to maintain stable ventilation. 4. Premature weaning. Pitfall: attempting to wean pressure settings or FiO2 before reaching baseline respiratory stability. Consequence: recurrence of respiratory distress and desaturations. Solution: delay weaning until FiO2 requirements return to baseline levels and the patient demonstrates stability. 5. Delayed recognition of retained secretions. Pitfall: failing to address secretion buildup, often signaled by desaturations or changes in respiratory status. Consequence: development of atelectasis, worsening gas exchange, and potential respiratory failure. Solution: regular use of airway clearance devices, e.g., cough assist, and prompt response to signs of secretion retention. 6. Underestimation of swallowing dysfunction. Pitfall: overlooking swallowing dysfunction as a contributing factor to aspiration risks and respiratory complications. Consequence: increased risk of aspiration pneumonia and further respiratory compromise. Solution: monitor for swallowing dysfunction and provide appropriate interventions such as modified diets or additional therapies. 7. Neglecting diagnostic assessments during desaturation episodes. Pitfall: relying solely on increasing FiO2 rather than investigating the cause of desaturations. Consequence: missed diagnoses such as atelectasis or ventilation-perfusion mismatch. Solution: use chest X-rays and physical assessments to identify and address underlying issues. 8. Insufficient airway clearance support. Pitfall: not incorporating airway clearance devices for patients who require ongoing support, e.g., spinal muscular atrophy patients using NIPPV around the clock. Consequence: ineffective mucus clearance, increasing the risk of complications like infections and atelectasis. Solution: combine an NIPPV with regular use of airway clearance devices tailored to patient needs.